Oh, yippee. Okay, I Chi. We've all done I
Thank you very,
Chi.
very much.
We've all
Okay.
done back hab. We've probably done I Chi Ni. So I don't want to show you how to do them. I want to apply them to balance. And that's what I'm going to be doing. The first thing I want to tell you is that alignment is key. Whether you call it posture, alignment, extension, that's what we need to have, because if we're living hunched over, we're prepared to fall. So as Beth taught, as Camilla taught, we need that upright alignment and we need the horizontal gaze, not looking down at the floor where we're going. So just remember that all three of these focus first on alignment, and they focus on postures. So I'm going to just play a video and sit back and have some popcorn here. I think we'll be very happy. Get this. Well, I don't hit that one. Okay. I Chi. You can all
There's her
see.
bathing suit.
I'm not going over I Chi. I'm going to go over the postures or the ideas that I think are so good for balance in I Chi, because I Chi is used predominantly for pain dissipation and for balance. So first of all, there's something called the vertical trunk sequence. And it means that you can stand with your feet in different stances, as we've already talked about. I think that was Katrine. And you can stand and maintain balance. That's one. Then head and eyes come next. Next is upper extremity, and that's where I Chi starts. We're in vertical control, and we want to maintain that vertical control while we move just to upper extremity. And it can be bilateral, contralateral. This one is a fairly easy one for people. Then in I Chi, it gets harder, because then it's unilateral. And in unilateral, we start to destabilize the body. It makes us asymmetrical and we start to tilt. So unilateral might be difficult for people on one side or the other, and you have to watch for that. But you can always use the head and eyes opposite to help to maintain that vertical trunk control. Then from unilateral, ipsilateral. I Chi uses ipsilateral movement when both arms are going in the same direction. And this destabilizes the body even more. And with I Chi, we use some weight shifting with it. So we're way over there, and it's very difficult. You'll see clients just do this ipsilateral movement here. And that's okay if that's all they can do. But be aware that it's following a sequence. We also have a sequence in lower extremity and trunk. We have weight shifting side to side. And we've seen people who weight shift with their hip first. And we see people who weight shift with their chest first. So instead, we'd like them to weight shift from the core. I'm going to use the heavy concept, and I'll talk more about it later in back half. Imagine surgical tubing tied around your waist, holding you off to the side. You can stand up and try this. And try to pull yourself that way, but you can't. The tubing is really strong. You'll feel core and muscles engage. We want the synergists and stabilizers to fire first. So I'll talk more about that later, but if you try not to be able to do it first and then do it, there's that proprioceptive trace in the muscle fibers, so the muscles know exactly what they're going to have to do. Sorry, I've got animals trying to help here. Okay, so weight shifting side to side, and we can do it eliciting the movement from the core instead of the hip or the chest or something like that. Then we switch to weight shifting forward and back. And this one's really hard for people with balance issues. Not weight shifting forward. That's how we walk. That's how we live. That's how we get up out of a chair. It's the weight shifting back that's hard. So people will put their weight on the back leg and they'll forward flex. Head will come forward. They'll internally rotate. But in I Chi, the spine has to stay straight and the arms open on this one. It's called accepting. This, I think, is one of the hardest because I consider it fall recovery. that from here, we have to go and weight shift forward. And you'll see people do this kind of stuff. That's not what you want. You want the shift to be from the core. Okay, so again, imagine surgical tubing tied around your waist. Your weight is on your back leg, and this works on land too. And now think that you're trying to shift forward, but you can't because that tubing is holding you back. It's the blue stuff. And so then gradually overcome that tubing and you come forward from the core. You don't have to move anything else. This is vertical trunk control with weight shifting. Then vertical trunk control with our stance in I Chi. We start first with a wide base of support, which is very comfortable for people. But it doesn't take long. We get into the trunk stability movements, and suddenly we go to a very narrow, long tandem stance. Okay, and that challenges balance in itself. So simply being in that long, narrow tandem stance will throw people off. Then we start to throw in different arms that can throw it off more, or head and eye movement. So those movements are so excellent. And then the turning skills to get from this stance to this stance. We need to be able to know how to turn, and that's part of balance too. People fall when they're turning. So we want to move again from the core rather than the leg doing it, the chest doing it, the head and arms going. So again, think about the tubing around the waist, this time to the diagonal, because this is the way we're going to turn. That means that the tubing is holding us back to this one, and we're trying to turn, but it's really hard, and you should feel the effort in the core. The core should tighten, and then actually turn using that core. You don't have to change your vertical trunk control, nothing, just use your core to do it. Then I love the lower extremity movements because we go to one-footed balance, and it's hard for people. So this one is called rounding. The back leg comes forward, toes to fingertips, and then we step back. What happens is that people will come up out of the water, like I am, to do this one because our balance is better. We're more stable. The deeper we are, the more destabilized we are. So we want to progress that way with rounding, and pay attention that that back leg is coming forward. We're weight transferring forward, and we're leaning forward. This should not be too hard, but sometimes coming back is hard. And you might have to think that it's heavy for the glutes, that the leg is being held forward and you have to pull it back. Balancing, I like this one too. Okay. Arms, instead of arms out to the side, they're next to the body, and that's harder. Arms out to the side gives us better balance than arms at the side. So we've got arms going straight down the sides of the body and coming back. And then the back leg, again, we transfer our weight to the front leg. We go into what I call pretzel, and then we go to Superman. Now, what I'd like you to pay attention to here is the weight-bearing leg and the fact that I'm out of the water and it's easy for me. Well, no, ignore that part. Okay, so the weight-bearing leg is now in flexion, and now it's more in extension. But watch what, we always pay attention to what's moving and not what's not moving, what's holding us up. So pay attention to that. And then my all-time favorite, which I saved for the last, is accepting with grace, which is the first of the trunk's lower stability, lower extremity movements. And we not only weight shift back, we weight transfer back. We lift that front leg. It doesn't matter how high that comes. What matters is that we stepped backwards, which is where many falls occur. So stepping backwards is going to be not too hard. Weight shifting forward is going to be a lot harder, again, without throwing that torso forward. So again, think heavy, that it's really, really hard to come forward, and you'll get core contraction, you'll get glutes in the back leg, but that accepting with grace, this is falling. This is the way we fall. So people don't have to lift their foot up really high. I mean, if you're looking for hip range of motion, then fine. But what people will do then is keep a straight spine. They're not going to lean back do that. Okay, I almost lost myself. So I think I Chi that tells you some of the things to focus on for balance for I Chi, and I'm hoping that it works for you.
Am I back? Thank you. Okay, so you might have heard my mistake in there. The weight bearing leg was doing the extension, not the non-weight bearing leg was doing the extension. But I think you all know what was happening. What I just wanted to show you is that you can use I Chi as a full plan, because the progression from upper extremity movement with vertical trunk control to trunk stability movement to weight shifting side to side, forward and back, changing the stance into a long, narrow tandem stance, and then going to one-footed stance. Those are great progressions inside the I Chi program. And so you can use it as a program, but feel free to pull an exercise that somebody needs, any one of those, or just use the overall concept. So are we good with I Chi? Do you want to comment about your own I Chi practice? Are you doing some of this already? Is there something that's particularly good for some of your clients or not working at all for others? Okay, let's talk about the weather. All right.
Ruth,
Yeah.
I have a question. I don't do I Chi very often, but do you ever do it with their eyes closed?
That's a good one. Basically, with I Chi, there are some light rules, and it means that you have that horizontal gaze, but with a very relaxed eyelid. Lots of people will do it with their eyes closed, and when I do that, I have no idea where I'm going to end up in the pool. I am moving all over. I don't have that proprioceptive awareness. So I think it's a great idea to take it as a progression to close eyes, but not start there.
Right.
Isn't that what you would say?
Yeah. And what about I Chi Me? Would you find that might be helpful because there's another point of contact sometimes, so that you can have them close their eyes but feel through the other person or the therapist?
I like that idea. I haven't tried it with I Chi Me because I don't use I Chi Me a lot, but I find it a regression, and that's where I have to start with some people. And as soon as I can, I want them away from me. And not away from me. It's just my balance is better by myself rather than with somebody hanging on me. So it's my own issue there. I think somebody else wanted to jump in too. I like that.
I just wanted to jump in. So recently I've had a couple of gentlemen that have had some lower back issues. And so trying to do a couple of, so the accepting with grace is a little bit difficult for them. So explaining to them that, number one, it's not wrong. The body only does what it does for the day. And really trying to explain to them how we modify for each person is important. And also understanding, so I've had like some slow days because of the cold weather. And so each of them has come in on a slow day. And I've noticed that when they're doing gathering, their one foot is going in an internal rotation. So being able to have them actually look down at the foot and say, I need you to actually, rotate that foot into a better place, and then tell me how that feels. And so actually having them fix the foot and then trying to move actually worked a lot better for them. So really kind of taking time sometimes with one person one-on-one is going to make a difference in their posture. And so sometimes that takes, you have to take time and not teach the class, but teach the person really makes a difference.
Yeah, people who have poor kinesthetic sense like that and can't tell where their feet are doing or what their hands are doing, having them look at it gives them an extra input. And I think we've all talked about that. I'm jumping to I Chi Ni right now, and we can keep on talking about all of this. I just want to make sure I get my 3 videos in because I'm such a star. You know, these are so great. I'm sure you're going to want my autograph after this is over. Here we go.
I Chi. Most of you know I Chi.
I'm
so
nuts.
I'm not going over I Chi Ni. I Chi Ni is maybe a starting point. If your client can't stand alone, I Chi Ni is partner. So you're always using a minimal assist. I'm going to go through a few of the postures and talk about them simply because I Chi Ni is not used that much. We have a section called symmetry. It's the one I Chi Ni begins with, and you're holding hands with your client. And this one, you always go to one-footed balance before moving. So you've got a shift and a one-footed balance in. You lift the knee of the knot of the far side, then just step across and then lift it and come back. It's one-footed, bending, stepping, segmental spinal rotation, all of those things. From the front, if I didn't have a partner here, you can see right through my partner. This is what it looks like. So we first go to 1 foot stance. This is important. We need to be able to do this. And we'd like people to be able to do it without the support. But this is how we go upstairs. This is how we step over a curb. This is how we get into a car. Any of those kinds of things. We need to be in one-footed balance, but not always upright. But sometimes with our knee bent. This is how we get into a car. You have to bend down to get into the car and then step into it. And that's not a step across, but you got the idea of why I like this one for balance. Then the next one is lift and you turn, but you're still holding hands. And then you lift and you come forward. So it's lift, turn, lift, forward. Here's what I like about this one. This one, I think, starts disengagement. So the client can look forward, but they're always looking at you. So ask them to look over the opposite shoulder so that they're not right there depending on you. So I like that one. Those two are part of the section called symmetry. Here's one more symmetry. Two more symmetries. Okay, this one's called seeking. Make sure my earbuds don't fall in the water like they did the other day. Okay, so this time it's lift, turn again, and then open so that you're back to back. And you may not need the minimal assist with your hand because they could be using you, or they could feel safe that if they start to fall back, you are there and your hand is going to grab them. Okay, so lift, turn, and then lift and come back. I like the no visual cue of this one. I like going back to back so that they have the support back there. Whoops, cat. Yeah, no, I'm sorry. Okay, so that one, I can't remember what I told you that's called. It's used in seeking, soothing, and freeing in the symmetry section. Now we're going to unity, and this one's my favorite, but I already talked about this one in regular I Chi. We're holding hands, and in this one, we don't lift to turn. We just turn, okay? We're holding hands, we turn, let go of our top hands, open behind, weight shift back. These arms are still connected and should go back. So you've got flexion and extension in one shoulder, adduction, abduction in the other, horizontal. adduction. Okay, so this is the way this one looks. And this is my partner holding my hand here. And so it's excellent for core. And once they're back here, you can cue the tubing or something, the heavy concept somehow to get that. And they're balancing in a long tandem stride. So this is good for them too. And then obviously I'm only showing you one side. We go to the other side and do the same thing. It's just, I want you to see this side of me because this side is so voluptuous, you'd be jealous. Okay, so the next one is accepting with grace, which we've already done with Tai Chi. We come through, we're pivoted, we're holding these hands, we let go of this one. Now and these arms will probably stay up because it's easier for balance. But if you can have them go down, that's fine. So we go to back foot, one-footed balance, and then come back, accepting with grace, maintaining vertical trunk control. You've still got one hand support. You're going to a 1 foot stance here, and the back foot is always harder for 1 foot stance than the front. Okay, you can do hip range of motion if you want that kind of stuff. That's not what I'm looking for. I'm looking for balance. Oh, we're on page 4, so we only have 2 left. Good. Another one, rounding. I just did rounding with Tai Chi. So here we come from center. We come over here. We open our arms. Weight shift back. And then the back legs, the legs that are closest to each other, come forward so that you've got 20 fingertips and 10 toes all up there. And people are rounded. And they're actually looking, we're supposed to round the spine in this one. So tailbone forward, chin down, and then come back. This one's called rounding, and that's what we do. And again, pay attention to the weight-bearing leg. You can get range of motion here, or you can just lean forward, bend the knee. If people have balance issues, have them just bend the knee instead of straighten the knee. It'll make it easier for them. And then the last one is balancing, which I already did, so let's see. Okay, I'm just gonna see if there's something different. You're holding hands, you pivot to this side, both arms go down, the sides of the body, and the back legs, the legs close to your client, come forward. So you've got 2 legs forward, 2 legs weight bearing, and 4 arms back. Then the arms come forward and we stretch into Superman. This one, these are so easy to do on your own, and you'll find your balance is challenged when you're doing it with your clients. So that's good. I think that's Tai Chi, and I think it's gonna work just fine for you.
I didn't remember that we had so many interruptions. I hope that was okay for you, but you got the idea. I just wanted you to see a couple of different ways that Aichi ni is used. And ni means 2 in Japanese. So it's partner Aichi. And if you are ever, my good-looking husband is delivering me freshly squeezed orange juice. So, but would you deliver it to everybody here? Okay, he shook his head yes, but then his eyes rolled up in his head. Doing Aichi, if you know Aichi, just hold hands and try it with some people. One of the first times I tried it, I was teaching Aichi at the World Disability Congress, and they had the patients and the doctors and the therapists all in the same classes, which was challenging. So we all got to the pool, and I had 2 helpers, one on each side, so I wouldn't have to move when Aichi turned, because I'm inherently lazy. And so we were fine. And this girl in the front, as soon as we went to unilateral movement, she stopped doing it. And I could see I'm guessing CP. I'm not sure. I never asked, but I got in the water with her and held hands. She followed the directions. She did everything perfectly. She directed me with her arms, but some people need that minimal assist. So go ahead and just play with it, make it your own, do your own kinds of things with it, and give it a shot. Okay, any comments about I Chi Ni? Fresh squeezed orange juice, cats, hair in the pool.
I love using the I Chi Ni and very specific patterns to help people on, you know, one or two things. It might be, they might be having a problem with weight shifting. Yep, or just stabilizing. And I always fit it into a little session. Yeah.
Good.
And even I Chi Ni I've done with 3 or 4 people in a small group holding hands for that accepting, putting one foot in, and we all balance off of each other's arms in the center, and then we open up. And I find it's been working in these small groups as well.
That is absolutely wonderful. Thanks, Julia. I use more vertical stuff because I think that's where people have to live. But your stuff today made me think, maybe I have to go back to more horizontal stuff.
Yeah.
Except no one wants to get their ears or hair wet. So,
No, that's right. I use I Chi probably more. Yeah.
but I don't know. Okay, I'm going on to backhab unless someone else wants to say something. And what Julia just talked about, this is what we should be doing. We should be saying, oh, I use it like this, or I have people turn their toes in or look at their feet, or like what Carrie said. Those are the things that really teach us, hearing other people's experiences. So start to gather them in your brain, and we'll see if I make you watch I Chi again. And
I have one comment on I Chi. I have the disc, the CD of Ruth teaching I Chi. And when I do I Chi in the pool by myself, I have Ruth on speaker and I close my eyes and I just do a wonderful I Chi practice, which I haven't been able to do for months, but I'm waiting to get back to it.
Okay, with that comment, when my I Chi instructor isn't there, because everybody who knows me knows I am not Zen at all, I stand on the deck and do it while I play Ruth's physical journey. So Ruth talks them through it and I show them on the deck. So yeah.
Those are all great ideas. I do whatever you need to do to make it work for people. All of you know that I have this rule that there are no rules. That the only rule there is to take care of yourself first. And if a technique says never use equipment, don't believe that. You use whatever you need to do to keep yourself safe. If a technique says you have to follow this direction, no, you do what works for you first and for your client second. So I'm not a good rule follower, kind of like Steph.
I Chi Ni.
Sure. What'd you know? I wouldn't get the right one up.
The heavy concept.
Yeah.
Backhab, I think that you know backhab, and you know different strides work different things, but I want to make sure I have time to go over my 3 favorite progressions because they are outstanding for balance. The first one is heavy, and I've already talked to you about it. While you're sitting there, or you can stand up and try it, imagine that you'd like to lift your knee up, but your foot is super glued to your thigh is super glued to the chair, and you can't lift it, but try hard and try harder. And it won't come up, it'll come up a little bit, but try harder and try harder. You should feel that core engage. The idea behind backhab is that we have 3 major movers in terms of muscle function. The prime mover, the synergists, which are the helpers, and the stabilizers, which help to stabilize. The prime mover is the more superficially placed muscle usually, and it's the one that gets the action going of what you actually want to have happen. What happens is that our bodies find the easiest way to do things, and the easiest way to move is from the outside in. So when you see people doing hip abduction, adduction, then most of the times they're not vertical. They're like this, or they're like this to get it, to keep themselves balanced. And so we would like them to use core instead of the more superficially placed muscles. The hip joint takes a huge beating during our lives. And by using the heavy concept, if you think about lifting that leg again, you'll feel that the effort is in the core, not in the hip flexor, not in the iliacus and psoas. So that's what we want. We want the effort to go back to the core because that's where balance is. And it's good for the joints at the same time. Okay, so we just do some heavy, 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 and that helps. But it's got to be done with upright alignment. Otherwise, you're teaching people every single time we are working with people, we're doing neuromuscular retraining. And if we teach them and let them do knee lifts, let them bring their knee up and their torso forward, that's what they're always going to do. So we need to teach this, that they lift it, that it's heavy, and they maintain upright alignment. Okay, so heavy can also be used as reverse heavy. I call it reverse heavy. This is just neuromuscular retraining, but my clients don't understand. Lift your knee up. Wait until I'm done explaining it, or your leg will be tired. Lift your knee up. Imagine you have surgical tubing tied just superior to the knee joint, and it's anchored to the angels in the sky, and they're holding it up. Okay, now you can lift it. And you want to put it down, but it won't go down. And you want to put it down, and it won't go down. You should feel the effort in the glutes. It takes the effort to the core. You shouldn't feel it radiate up into the low back. But some people will try to press it down by pushing their chest forward. That's because that's what their bodies have trained them to do. So heavy, reverse heavy. If you stand up, if you're willing to stand for a minute, imagine the tubing around your ankles and that you want to do hip abduction, doesn't matter which leg, but that tubing is holding you. You're trying to lift it out. It's still holding your ankles together. You should feel that effort in the core, not just in the legs. So try the other leg too. And then let's try reverse heavy. Your leg is out. The tubing is around the ankle. Angels are holding it up and resisting it for you. And then imagine you want to pull it down, but you can't. You should feel this. You should feel the core engage. That's the whole idea. Couple of things. One, I have people not be able to do it first, so that I told you that the muscles have that proprioceptive trace and they know what they're supposed to do. They know the order they're supposed to work in, instead of just have them think heavy. However, if you've got a client who's got hypertension or some other pain issues, then possibly you don't want to have them just not be able to do it, because when you're pulling down and you can't do it, the natural inclination is to go into the Valsalva maneuver and hold your breath against a closed glottis, which is not good for people with hypertension and things like that. So watch how you teach heavy. Know that you can't do many repetitions, because after the fifth or sixth one, people will start to, they'll be gone. And this is very cognitive. If you don't have clients who have good cognition, it's not going to work for them either, because it's the thought. It's not the tubing. If you actually use the tubing, people will still work from the outside in. Try putting tubing around somebody's knee, and they'll just push down the way they normally do. It has to be cognitive. Okay. There was something else that I thought of, but I can't remember it. And hopefully I'm remembering it now, and I'm going to tell it to you in a moment. So the heavy concept, working from the inside out, excellent for balance, because core is balance, in my opinion. Okay, heavy concept. We use it for weight shifting. So we can use it for a lot of things, but weight shifting is a good idea. teach people to move from the core. We used it for turning skills, teach people to move from the core. We can use it for upper extremity, for shoulder flexion, extension, abduction, adduction, internal, external rotation. It works for all of it. So if you want to use it on a specific joint, that's fine. But if you just want to make sure that the core is working where it's weakest, it's usually lower extremity movement that does that is the hardest to get the core engaged. Okay, so heavy concept, then start and stop. I don't think I have to tell you, because especially in the water with the drag forces, stopping and starting challenges balance. So when they start, people will want to, almost no matter what you have them do, but they'll want to lean forward to get going. That's not core, and that's not going to help balance. Instead, you have them step forward with vertical trunk control, and then you're getting the balance. The same if they stop and have to move back, or if they're moving sideways and you have them stop, or if you're actually moving a limb and you have them stop and start and stop. What happens is that the muscle fibers have to be re-recruited, and you can't just use momentum. So the start and stop is excellent. Use it with upper extremity, lower extremity. It's always going to challenge core. It's always going to push just a little bit harder than what you're already doing. And then slow motion is one of my all-time favorites. And I think best to just talk about it in the lecture, because you can, I don't need to show you slow motion. Well, because I'd probably fall down. But what you want is in back half, we want people to move as slowly as possible and to get the trunk glide during that. Because what will happen is they'll get their leg moving slowly, but they'll keep their weight over the back leg until the front leg's ready to go down, and then they'll go like this, okay? But what we'd like is the trunk to glide forward slowly during the leg movement, okay? Or back. In back half, we use a variety of strides to achieve different things. I'm not going to talk more about it now. If we have time, we can talk about back half, but I think most of you know it, and I'm just happy. I'm just happy. I'm just happy to be with you. I hope that these ideas are good for you.
Okay. So I didn't show you back hab, but it's a walking program, because what happened was I had people who had back problems in the pool, and the doctors had sent them. So I thought, well, glutes are weak, hip flexors are strong. We'll stretch the hip flexors, we'll work the glutes. And we stood at the edge of the pool and did all these exercises for different things. And people would get out and they'd walk across the deck still hunched over and in pain. And I thought, well, if I want them to be able to walk with pain-free mobility, I better put these exercises right into strides. So that's how back hab started. It's just walking with different exercises. And once people started doing well, we started getting people with shoulders, with knees, with CP, with MS, with a variety of things. And so then we had to add progressions. And there are a variety of progressions, but you just heard about my three favorites. The heavy concept changes muscle recruitment pattern from the outside in to the inside out, which is excellent for balance. Stop and start movements, whether it's a limb or the entire body, help with core. And it doesn't have to be stop at the end of a movement. If you have somebody doing elbow flexion and extension, have them stop partway through and at the end, so that every single time the muscle fibers have to be recruited. And even though it looks like this is only biceps, it's core. As soon as you stop, the core has to get engaged to keep you upright. And then, slow motion. I didn't get to show you, well, I showed you a little bit of slow motion. Slow motion you can use, again, with upper extremity, lower extremity movements. You can use it bilaterally, unilaterally, but I find putting it into normal gait is the most effective thing for balance, because as soon as people start slowing down, they start to lose their balance. The way I always describe this is to picture yourself riding a bike, and you're riding along nice and fast, and then your balance is good then. And then you have to slow down and slow down more, and finally you're wobbling all over. That's because when we move quickly, we're always covering up a myriad of falls. So if you go up the steps getting out of the pool where there's drag, no drag, whatever it is, if you go fast, you're covering up issues. If you move, many times when you move quickly, you're covering up a fall, an almost fall. So slowing it down is very difficult. When people are walking, they will start to slide their feet instead of roll heel to toe. They will start to lift their knee up to fill up the time, and also to have a short lever moving through the drag of the water instead of the straight leg. So you need to make sure that their stride, have them walk normally first, and then they have to apply that stride to slower movement, and then slower movement and slower movement. And they'll start to put their arms forward. That's not it. We need reciprocal arms for good balance. They'll start to hunch their shoulders. No, that's not it either. We need to be relaxed for good balance. They'll put their head forward. They'll do a variety of things. And you need to check what their compensatory patterns are, and then start to modify those while they're doing slow motion. Okay, that's all I have to say, except I love you and thank you very much. Who wants to talk?
I'm going to talk first because this is Linda. And I just want to remind everybody we have 9 minutes until I'm going to say that's it. And go ahead and ask Ruth anything.
The orange juice is great. Yes, thank you.
I was gonna say with back cab, I think one of the exercises that's one of the best ones for balance is walking with circumduction. Just as I love that one. Yeah.
And what I didn't say is that every stride goes forward and backwards. So thanks, Beth, for just thinking of circumduction, because circumduction, walking backwards, is it's like, hello, glutes. Whoa, I didn't even know I had you. So backwards walking, and what happens when we get older, or right now with people with their phones and they're always hunched over? Your job, before you can fix any hip or knee or shoulder or anything else, is going to be to teach alignment, teach people posture again. Yep. And one of the best things you can do is have them walk backwards in the water. Because when you're walking backwards, you're getting triceps, you're getting posterior delts, you're getting glutes, you're getting the extensors that are so weak from living on land. So it doesn't matter if you ever use back cab, just have people walk with good alignment and have them walk backwards and do circumduction. That hip circumduction kicks butt. It sure kicks mine anyway.
Yeah, and you really see the asymmetry when they have one-sided. That really shows up in that particular one a little bit more.
I have the back cab trifold at our pool that I leave there for people to do class. And I've changed the top of it. I've crossed out back cab, and I say water walking for exercise, because they've always told me nothing wrong with my back. So kind of changed the name of it.
Oh yeah, no, it's my hip. Talk to Beth about that.
Right. And another thing, when they're going backwards, I love using the slow concept. I love using that one. But when they're walking backwards, talking about posture, you need to make sure they're not leading with their tushes. Because when people walk or run backwards, a lot of times, especially in the water, they lead with their tushes. And so that's real important to make sure that those tushes are tucked.
Yeah, no forward flexion.
I find like I have a lady who has MS, and she has a tendency to launch herself when she's walking backwards. She doesn't walk, she'll launch herself. And so, that's not even good posture. But posture's almost always the first thing we work on. And the second thing I have to look at is, do you even know what a step is? Because some people don't even step. Their step is so long that they can't even engage that core or those glutes, because they don't even feel the glutes. That step is what, like, I take big steps. No, you don't. You're taking a stride that's humongous. I can't believe you're back and
And
you're,
then they
you know,
often lose heel strike. And you've got to have that heel strike because Julia just showed us how important
Mhm.
dorsiflexion is. So yeah, those are my favorites. And I think for balance, we've got so many, pelvic floor engagement. You really want me to talk about that when I have to go to the bathroom right now? It's, is Camilla on?
Let me interrupt a minute. The next session is our time to discuss all these things. And so when we take our break, we'll be back and everybody has a chance to ask anything they want to ask. And that will be a great time to discuss that. And I know Camilla's on, and so she can talk about it then. One other thing, you talked about, you do everything right in back having the pool and they're walking and they come out and they're forward again. Julia's on. Julia gave me a hint many years ago, and she's probably forgotten about this. If you're in a pool and it has a slanted bottom and you've been working on them, you walk backwards to the steps before you turn around because you maintain the correct body position.
Thank you. Yeah.
I got something too about pelvic floor. If you guys are really interested in pelvic floor, I'm looking to find out what days it is. But in the new spring fling, there's a whole bunch of stuff dedicated to the pelvic floor.
The new spring
Right.
thing is right. It's new concepts. It's pelvic floor is becoming more and more popular. Not that it hasn't always been there. It's just become part of low back issues. It's become part of gut issues. It's become part of breathing issues. And so pelvic floor is a new concept in particularly ortho work. And so there are other new concepts, the myofascial that Donna does and that Beth does. Myofascial, that's the new muscle. In your lifetime, people will stop talking about fixing a muscle and they'll start talking about changing the fascial tissue, getting the knot out of the fascial tissue. And so I think we need to be on top of those things. And that's why I thought we needed a new concepts. And Mary, thank you very much for organizing this specialty certificate. I've been enthralled every week. I'm just having a ball. So anybody else want to talk?
I want to say that in the next hour, as one of the instructors earlier on, I really would like you to come with the one thing or the thing that you're walking away with, like what really hit home for you, as far as how are you going to implement this? What was it that changed in your practice, so we know where we got, and maybe if there's anything that's still a little fuzzy or not clear, let's go down that path and revisit it. So that's kind of where I would like to not just chat about rainbows and unicorns, but also kind of make sure we got what we were after. So.
Perfect.
That's exactly what we want to do because there is no handout for the next session. So this is your time to point out what you got, where you're still fuzzy, and did you like the progression and anything that you want to ask. Many of the instructors are here for you and they can help answer the questions. So it's about time. We have what, 2 minutes left, a minute left. So when we take our break, come back and be prepared to take part. This is not for us to just talk to you. This is your time to let us know what you need to know, what you're interested in, what you liked, what you didn't like.
My favorite was learning where the word Wawa came from. This is so joyful for me. It's so I leave with a high every week. So I'm glad we're going to continue with another specialty certificate because I need that high.
I think it's great. Okay, by my laptop now, it is 10:50. It just turned, so we're gonna say goodbye, go hit the potty, get a drink, sign back in to the third session, and we'll see you in a little bit.